who has come, Mr. Conyers. Thank you.
Sheriff McDonough, you are recognized for your opening statement.
All right. Sorry about that. Chairman Gowdy, Ranking Member Jackson Lee, and distinguished members of the subcommittee, thank you for inviting me to testify this morning on behalf of the Major County Sheriffs of America and the National Sheriffs Association. As sheriff of the largest county in the United States and as a peace officer for more than 35 years, it's an honor to represent the sheriffs who are sworn to protect more than 100 million people across our great nation. Policing in America has never been more complex because we are the first responders to some of America's greatest social challenges. Whether it's the growing opioid epidemic, the emerging threat of cyber terrorism, homegrown extremism, and the growing prevalence of mental illness across our nation, these are the 21st century challenges we should and must meet together. I've submitted written testimony that expands on what I can share here due to time, but it is available on the website. I will, however, be able to touch briefly on a number of critical topics. Last Friday's cyber attack that attempted to strike 150 countries should make it crystal clear just how vulnerable we are and the potential scale that such an attack can have. These are complex threats that often lurk just beneath the surface of today's news headlines. Often they become known only after the imminent threat of a pending attack is made, or worse, after the assault itself. These are threats that challenge our government and bureaucratic institutions to be adaptive in our solutions and in our collective response. There isn't a sheriff's department in this nation that's immune to the impact that mental illness and drug addiction are having on public safety and our jail systems. The deinstitutionalization of the mentally ill that occurred in the 60s and 70s have turned our jails and prisons into de facto mental health hospitals. My jail system in Los Angeles County is the nation's largest mental health institution. 70% of the inmates processed into our jails report a medical or mental illness. Nearly 1/3 of my jail population suffers from some sort of serious mental health issue. On any given day, upwards of 5,000 inmates need treatment for their illness. That population is forecasted to double over the next 10 years. In LA County, we'll need to invest more than $2.2 billion in a new consolidated correctional treatment facility that can provide the mental health and medical services for this population, which has nowhere else to go. Los Angeles County Jail, along with Rikers Island Complex in New York City and the Cook County Jail in Chicago, are the top 3 largest mental health care providers in the nation. This is a failure of our criminal justice system nationwide. Are there times when jail is the best or most appropriate option? Yes. But it's our experience that jail is frequently not the best solution. As a nation, we have a critical need and a moral obligation to build capacity for treatment options in our communities. We have the ability to support strategic partnerships with our mental health and social service agencies to provide the kind of wraparound treatment services that can stabilize these individuals and keep them out of our jail system. We have a professional obligation to provide training for our officers, of whom too much is expected. Too often our deputies arrive at a call for service, always facing the unknown and frequently facing a situation where they're asked to take on the role of a mental health professional. In Los Angeles County alone, in areas policed by the Sheriff's Department, 911 calls involving people with mental illness have grown 55% since just 2010. We need to fund and provide crisis intervention training to all first responders, both law enforcement and fire personnel. Let us work together toward a nationwide expansion of highly successful program of teaming up mental health professionals with law enforcement officers who work as an intercept first responder team. In Los Angeles County, for instance, we've had these teams since the 1990s. Some other major cities and counties throughout the nation have some variation of this program, which are also highly successful, but seriously overworked and understaffed. Most cities and counties that operate such a program cannot provide the service 24/7, and in many places, because of the geography, it becomes very difficult to respond in a timely manner. However, in our experience, when a team such as this is called to a scene, we have the ability to divert the individual away from the criminal justice system and into proper mental health treatment facilities in 99% of the encounters. The third step is diversion. I'd like to thank Congress for passing the National Stepping Up Initiative, which provides counties and cities with funding to divert those dealing with mental health illness away from our county jails. We should also look at dedicated mental health courts that could recommend better options for those suffering from mental illness other than jail or prison. And lastly, we need to have an adult conversation about what to do with those suffering from mental illness that do end up in the criminal justice system and in our jails and our prisons. We as a nation can agree that not everyone suffering from mental illness or other disabilities can be diverted. Some individuals who are pre-trial and classified as a harm to themselves and to others will end up in our jails. As such, we need to provide the most humane, modern, and safest setting for them so they can receive the treatment and get the help they need. The MCSA and NSA seek to be a positive source of ideas. We look forward to continuing a dialogue and working with you. We can't be successful unless we as a nation are committed to finding solutions. I thank the Chairman for his commitment to collaboration and willingness to engage in local law enforcement on these issues that are so critical to all of us. Thank you very much.
Thank you, Sheriff.